Good morning. Thank you all for coming here today to witness our groundbreaking, what we would call an implosion here in Las Vegas and Clark County. We're very excited to give you a sneak preview of what our new health facility will look like. With this facility, we'll be consolidating 3 other buildings around the valley, one on Valley View where our main headquarters is, one over at 625 Shadow Lane where we have a clinic, and 400 Shadow Lane where we have other clinics. And so we're excited to have you here to help join us in celebrating this event. We do have a variety of people here who I'll introduce in just a couple of seconds, but this will house our main facility once we're done for the entire valley. We still will have other facilities that are available for people up in Mesquite, down in Laughlin, and other areas, and you can find those on our website. So we are consolidating a variety of programs here, and you'll see me gesture in just a second. If you look in the far area over there, that's where our clinics will be. So our nursing services, our maternal child health program, sexually transmitted diseases, tuberculosis is over in the far area, and immunizations will be here as well. We do have 3 buildings off to the side down there that you can see once you exit the building, look down there, they're part of this complex, and they will be joined to this complex when we finish the construction. And we'll have food handler cards down there, we'll have vital records down there, and we'll have our EMS and trauma systems down there. And that's to allow access to our fire services and our ambulance services for the kind of work that we do with them and to the public, which will then allow us to have different hours for those facilities down here. About back over there behind that table is where environmental health will be. And those are the programs that do a variety of things, including restaurant inspections, underground storage tanks for diesel and gasoline, and a variety of other programs that we offer here in the valley. We'll have an Office of Epidemiology, which will be over in that area, roughly, a finance office, which will help to support us and in the entire Southern Nevada Health District. Management will be over there. We'll have information technology here. Behind me will be a variety of areas where we do storage, and we'll be storing vaccines and a variety of other things. We do have another program called Informatics, which helps us to translate data that we get into usefulness for us and our Valley partners, and help us with our software programs. We'll have chronic disease and health and promotion and vital records as well. So we look forward to continuing our service to the people and the organizations here in the Valley that we partner with. And they are innumerable, from police and fire, first responders, to the schools, to the hospitals, to EMS and trauma systems throughout the Valley, to people who come in and want immunizations or family planning services. So we have our incoming chair for our Board of Health standing to my left. This is Councilman Bob Beers, and so I'm excited to turn the microphone over to him and have him say a few words. He has been around longer than I have, and so I think he's seen this transition from us going from one building to many buildings when the other building was inadequate, and now coming back to coordinating most of our services out of this building. Mr. Beers.
Thank you, Dr. Ayesir. I'd like to thank the Supreme Court. That was a laugh line for you people in the back, by the way. This was a long, tortured process that actually did involve rulings by the Nevada Supreme Court and gave us ultimately the resources fueled from several years of putting away a little bit of property tax to be able to put this building together. On an ongoing basis, we will not be paying rent, and that represents dollars that we'll be able to put back into the provision of public health and safety in our valley, which is a very cool thing. I would be remiss to not mention that we're in the heart of the redevelopment area number 2 in the city of Las Vegas. As you came into the building today, you saw that the shops all around this building are empty. And not too long ago, this was a very thriving commercial center. And with the return of people to the neighborhood who will be coming here to get their health cards and get their EMT licenses and get their fire trucks and their ambulances checked out, we're hopeful that the city is hopeful that we'll see a resurgence in this entire corner, this whole intersection, come back to life. So it's kind of a win-win all the way around. Dr. Ayesir?
Next, I'd like to introduce Mr. Christopher Lawson, and he represents PGAL. I actually learned how to do that. We, for a long time, called it PGAL, but we know better. It's PGAL, who have been the architects for this entire complex. Chris?
Thanks, Dr. Ayesir. This has been a long process. We've enjoyed working with the Health District for the last 8 years, helping them find this location. It's taken a while, but we think this is a great location, as Mr. Beers said, and as Dr. Ayesir said. This facility, this 120,000 square feet, all total, helps the Health District consolidate and create one central area. As Dr. Ayesir mentioned, all of the public clinic areas up in that front area will be served by sort of an open mall area for the public. So it'll be a welcoming place for the public to come in, easily recognizable which clinic they want to go to, as well as any visitor coming who has to do business with the facility. Again, we've enjoyed working with them. We're looking forward to working with Martin Harris and the rest of the team to bring this into fruition. And we're just excited to see this day happen.
Thank you. And last on our speaker list would be Mr. Guy Martin, who's the Senior Vice President for Martin Harris. He will be our general contractor.
Thank you very much, Dr. Ayesir. Historically, Martin Harris Construction loves to do community-based projects. This is a very unique one for our valley, I believe, because it's a building that's being repurposed. It is going to rise again and become the cornerstone of the community, both for serving all of Southern Nevada. We're very excited to be a part of building this cornerstone to our community, and we certainly look forward to all of the challenges. With that, I have a ceremonial presentation for Dr. Ayesir, if I will. Typically, we give groundbreaking shovels, but that seems to be a little inappropriate for this particular environment. So with that, we have a special gift for Dr. Ayesir.
Thank you, and if I can read it, it says Southern Nevada Health District Wall Breaking Ceremony, July 22nd, 2015, presented by Martin Harris Construction, but they actually won't let me use this. So we have one right behind Mr. Lawson that we'll use for the ceremonial wall breaking.
We figured it would be kind of a bad first day to have the head of our local health district wound himself. So with the appropriate PPE in place, Dr. Ayesir, the floor is yours.
And if I may, I have been known to wound myself several times in the past. Thank you. So I will tell you that they gave me a shorter one that I practiced on over there to make sure that I can actually make it through the wall. I don't want to finish this without thanking all of the governmental agencies who have been supportive of us and helpful to us, and in particular the City of Las Vegas. We are currently within the city limits of the City of Las Vegas. They've been very helpful with going through the permitting process and providing us a few extra dollars to help us with some of the nice things that we'll be able to do to the outside of the building. So we really do want to thank Mr. Beers and Lois Tarkanian in particular, who are the city's representatives on our board. And then we would ask to see if you have any questions. We will stay around here, and I'd ask Sean and Andy to come up if you want to help go through some of these renderings with Chris to see if you all have questions for that. Are there any questions that we can answer before we go to that phase? Thank you all so much for coming. We really appreciate the interest that you have, not only from the community, and I see some friends from the fire department over there, from the community that we serve and will continue to serve even better, we hope, from this location. So thank you all very much for coming.